If you are studying pharmacology or getting ready for NCLEX, do not skip lithium. This is one of those meds that looks simple at first, but the exam loves to test the safety points. If you miss the therapeutic range, the sodium connection, or the toxicity risk, you can lose easy points. Let's break it down. If lithium shows up on your exam, the test is usually not asking for deep psych theory. It wants to know whether you understand monitoring, safety, sodium balance, and toxicity risk. Lithium is a mood stabilizer used mainly to treat bipolar disorder, especially manic episodes. Its exact mechanism is not fully understood, but it is thought to affect chemical signaling in the brain, including neurotransmitters such as dopamine and serotonin. A major test point is the therapeutic range, which is 0.8 to 1.2 milliequivalent per liter. That number matters because lithium has a narrow therapeutic range, so the difference between a helpful level and a toxic level is small. Patients taking lithium need regular blood draws. Early on, levels are checked more often until they become stable. After that, monitoring continues at regular intervals. This is one of the biggest nursing priorities because lithium can become toxic if the level rises too high. Now let's talk about the side effects and teaching points the NCLEX likes to test. Patients may experience increased urination, thirst, fine tremors, and upset stomach, including nausea, vomiting, or diarrhea. Lithium can also affect the thyroid, so hypothyroidism is another important issue to monitor for. Since lithium interacts with many medications, you also want to review the medication list carefully. Here is the big concept you need to remember. Lithium and sodium are closely related in the body. If the patient becomes dehydrated or loses sodium, the body may retain more lithium, and that can raise the lithium level and lead to toxicity. That is why patients should maintain consistent fluid intake and avoid sudden changes in sodium intake. In plain terms, do not tell patients to cut salt out of their diet unless a provider specifically manages that plan. A sudden drop in sodium can increase lithium retention. So for NCLEX, your teaching points are clear. Take lithium exactly as prescribed. Keep fluids and sodium intake consistent. Show up for blood work. Watch for side effects. And report signs of toxicity or worsening symptoms. Another key point, lithium may take 1 to 3 weeks to reach full effect, so patients need to understand that improvement may not be immediate. And one more major safety issue, lithium is teratogenic, so pregnancy considerations matter. So the quick breakdown is this. Lithium treats bipolar disorder, requires level monitoring, has a narrow therapeutic range, and becomes more dangerous when sodium or fluid balance is disrupted. That is the core of lithium for NCLEX. Nursing students, stay focused, think safety, and pass the NCLEX.